Welcome, everyone, to the latest edition of the WRAP Employee Podcast. I'm Jeremy Fallis with the Department of Communication.
And I'm Lilia Simic, also with the Department of Communication. Today, we're celebrating the 5th anniversary of World Delirium Awareness Day at Michigan Medicine.
And we're joined today by 5 incredible guests. Let's each have them introduce themselves. First, let's have you explain your roles in the organization when you do, and, tell us something fun. Spring training is underway in baseball. March Madness is around the corner. What is one thing that always signals to you that the warmer weather is right around the corner? Lakeisha, why don't you go first?
Hi, I am Lakeisha Ben. I am one of the clinical nurse specialists on the Medicine Unit 6A. I'm also the co-lead for the Nurse Practicing Evidence-Based Fellowship, and also the chairperson for the Delirium Prevention Committee. And one fun thing, when I know that spring is around, I'm a runner. So then I get out in the wintertime. I don't get out as much, but then when those temperatures start, I can get out and I can run outside.
Wonderful. Nicole?
Hi, my name is Nicole Morphus. I'm a staff nurse at 6C. I work in med-surg and I'm on the Delirium committee as well. I know spring's coming up mainly when my birthday rolls around, but I just love seeing all the flowers and all the new growth after the dead of winter.
Hi, I'm Kiera Knox. I am a registered nurse in the Ambulatory Care Ruggles Cancer Center, and I am also part of the Delirium Committee. Spring means planting flowers. It's when I get my flower bed together for the front and back. It's a big ordeal for me.
Hi, my name's Amy Rosinski. I'm a psychiatrist at Michigan Medicine. I'm a consultation liaison psychiatrist, and that means that I help care for patients who have complex interface between medical, surgical illness and psychiatric illness as well. And I currently am in the ambulatory section of psychiatry working with cancer patients. And I've been a member of the Delirium Committee also for many, many years and have really enjoyed that work as well. I think for me, I know spring is coming when I see the squirrels in my backyard starting to come to life, or even on the diag. Those very unusually colored squirrels on the diag are a sign that it's spring.
Those are some fat fox squirrels. Karen, how about you?
Hi, I'm Karen Wilson. I'm the clinical nurse specialist for Mott Hospital on 11 West and cardiology. And I know that spring is here because I've started my seeds for my garden, just like my fellow colleagues, and also because Little League is starting.
So let's get started with the basics. What is World Delirium Awareness Day and why is it so important? What impact does delirium have on our healthcare systems, our patients, families, caregivers, and even us as healthcare workers? And why is it so important that we promote World Delirium Awareness Day? Lakeisha, do you want to kick us off?
So you can better understand the significance of the day. Let me first define what delirium is. Delirium is acute change in a person's behavior and thinking, and they're normally confused. They just act a little bit different. And the acute change happens within hours to days. And if we treat the underlying cause, then the delirium is usually treatable. And so let me explain a little bit about World Delirium Awareness Day. It began in 2016 as a global effort to raise awareness about delirium, which is incredibly common and often missed. Prevention starts with recognizing, and awareness empowers healthcare teams to intervene earlier, and it improves patient outcomes.
Yeah, just to piggyback off, Lakeisha there, delirium is not really, people think of it as being a benign thing. Oh, the person's just confused, but it's really, considered a medical emergency because it signifies that something is wrong. Something's not functioning in the brain. And it's tied to higher hospital or longer hospital stays, falls. Some people have cognitive decline that never fully makes it back to baseline after an episode of delirium. And there's increased mortality even when people develop delirium. So I think promoting awareness of delirium in the health system at large is really important to make sure people aware of the consequences of delirium, and also really, like Lakeisha was saying, that some delirium is preventable But you really have to be intentional of educating people and making them aware of the risk factors and the precipitating factors of delirium so that we can try to prevent some of these cases.
Right. And I mean, at the bedside, families and patients are scared when this happens, but the best thing to do to prevent delirium would be things like mobilizing people early, getting them up and out of bed, putting the light in the room, encouraging sleep.
And along with some of these interventions that we do for adults, this is also for children. Young children are at risk of delirium as soon as 24 hours of admission to the hospital, and then most symptoms manifesting after day 5. And some of the risk factors do include an ICU admission, mechanical ventilation, but also developmental delays and a younger age. So we watch children very closely and assess them because they can present with both hyperactive and hypoactive symptoms or a mix of both. And that's how we assess if they have delirium. They're not always able to describe what they're feeling, so our assessment is key to prevention. I believe that raising awareness that delirium isn't just an adult issue and that the kids need special consideration is important with the World Delirium Awareness Day. And we want to make sure that this population is not overlooked because it can lead to cognitive issues after discharge and also prolong their hospital stay as well.
Yeah, that's a great rundown. And Kiera, why is delirium awareness important in the ambulatory care?
Like some of my colleagues have said, we're just really trying to get a hold of these things early, some of the symptoms or some of the changes that the patient may be experiencing. The biggest thing is that delirium doesn't stop in the inpatient setting, and that is what we're trying to get across, looking at ambulatory care as a whole. We see patients, before, after they are having like procedures or targeted therapy, chemotherapy, and some of these interventions can lead to cognitive changes. So with that, over here, we have been making sure that we are assessing patients, looking for families to tell us if they've noticed subtle changes like behavior or new confusion, trouble thinking, things like that, so that we can early prevent and try and prevent from escalating things further.
Let's take a moment to rewind to the beginning a little bit. So how did Michigan Medicine celebration of World Delirium Awareness Day all begin?
So Lilia, 5 years after the global efforts of World Delirium Awareness Day happened, Michigan Medicine got on board in 2022. So the first year, it was simple and effective the way that we got the information out. It was email. We emailed delirium prevention toolkits to all of the adult hospital units. And so that is how we started our journey with World Delirium Awareness Day.
And it sparked new conversations from the bedside perspective. We started thinking more and more about delirium.
Yeah, I've been being on the committee for a while. Those early kind of efforts, while they were simple, kind of laid the groundwork for everything that followed. And Jennifer and Lakeisha really took the reins on this. Jennifer kind of was in Lakeisha's position before, and they really took the reins and ran with it.
I think with all of those initiatives that were started, it established that there was a need to involve the pediatric community in this work. So in the future years, that was part of the goal.
And if I remember correctly, the second year was much more about connection, bringing delirium awareness directly to the nurses in simple, high impact ways. How was that taken care of, Nicole?
Yeah, so mainly just during shift changes, morning and afternoon, we just kind of greeted the nurses at the door, said Happy World Delirium Awareness Day.
Jeremy, to reinforce that message, we brought back the toolkits. We sent those toolkits back out. And as Nicole was saying, we greeted the nurses at beginning shift and at end shift with these lapel pins that just had World Delirium Awareness Day 2023. That went off well. And it was a good opportunity to refresh everyone's memory and remind them that it was World Delirium Awareness Day, and to ensure both the new and existing staff. So, staff come, go. You have people like me, as Amy was saying, I kind of took the reins from Jennifer. Jennifer brought up the World Delirium Awareness Day, and when we switched off and I became the chairperson, I was like, okay, what are some other things, Jennifer, that we can do? And so those lapel pins were really really a hit. And then again, reminding the newer people that came to Michigan Medicine, this is what we're doing with our delirium prevention efforts.
Yeah, and I think on top of that, Lakeisha and others on the nursing, quality excellence various committees throughout the hospital then partnered with patient safety and quality teams in nursing. It's interesting because World Delirium Awareness Day falls the same week as Patient Safety Awareness Week. And so that alignment with World Delirium Awareness Day and Patient Safety Week really kind of helped amplify the message. I think of delirium as a safety and quality issue, and there's quality metrics around delirium in health systems across the country. And so that fortuitous timing really kind of helped bring delirium to the forefront as like a really core safety priority for the health system. And we were really fortunate to have that partnership with safety and quality teams.
And as we, continue to address this as a system-wide initiative, ambulatory care wasn't a part of World Delirium Awareness Day. And as we are continuing to look at delirium as a risk or looking at preventative methods, we now are here and being able to address it in year 5.
So year 3 was a major turning point. This was the year you made a major shift from awareness to action. Amy, could you talk a little bit about this?
Yeah, sure. Absolutely. Year 3 is when, our committee established more of like a multidisciplinary rounding approach, borrowing heavily from our colleagues that doing this for sepsis. We really liked the way that they were educating about sepsis, which is another major clinical condition that has severe implications. And so we started this rounding process around the hospital, and the group of rounders was pretty robust. I mean, there were nurses, advanced practice nurses, physicians and advanced practice providers, pharmacists, social workers, and we even had a psychiatric care nursing aid worker. So it's a long title, but those aid workers are individuals who provide direct support in patient rooms for people with behavioral or mental health challenges. And a lot of people with delirium have behavioral challenges and need someone sitting with them directly at the bedside. And so those psychiatric care nursing aid workers have so much knowledge and perspective on delirium and really can educate in a way that's really unique. And so to have them join our rounding team was really wonderful. And they're just great people. I've worked with them for years and really appreciate them and shout them out right now. They know who they are. So it was really the first kind of system-wide rounding effort that year. I don't think I was able to be a part of it that year, and I was so sad to miss it. So I made sure to make up for that the following year.
And to just follow up with what Amy was sharing, I am... my work in hospice and palliative care background, I've always worked with multidisciplinary or interdisciplinary teams. So this multidisciplinary rounding, it was right up my alley. And I'm also outside of nursing and doing all the things I love to plan, and I love to do fun things. So assembling the rounding carts and adding activities and the snacks and of course the resources, I was on board with that. And so our rounding carts became iconic. And again, it's stocked with resources, snacks, activity, and swag, our famous t-shirts that nurses love. Another t-shirt. We have 1,000 and we love to get another one. So nurses, if they're engaged, if they can come and participate in the rounding, they enter a drawing to win a t-shirt. And then we have other swags that's available to everyone.
Yeah, it really gets the swag and the snacks really get people to come around the cart and engage. And another great kudos to Lakeisha for really organizing this. She did a great job with her organizational skills and making it fun, right? That's the point, I think people remember things that are more fun. That year was the year we expanded to the emergency department. So one of our internal medicine physicians on our committee, Stacy Blackburn, she just happened to take a detour into the emergency department. And the staff were really engaged there and wanted to be included permanently in future rounding. And the nurses in the emergency department were really happy just because they shared a lot of times they have patients boarding there for a long period of time waiting for a bed. And that those conditions are often right for their patients to develop delirium because they're isolated, they don't have access to windows, they may not have their own bathroom. So those nurses really also want to be educated on delirium. So Stacy was a happy accident, but important to include the emergency department as well.
And we also expanded into our rounding into Mott. So we made sure that we went to Mott Children's Hospital, and that made World Delirium Awareness Day a fully system-wide initiative.
So the team's rounding in Mott was very well received. Pediatric delirium requires a different lens, developmental stages, family dynamics, communication differences. All of this led to the multidisciplinary team coming together to bring those unique considerations to the front line.
Yeah, and collaborating with the pediatric hospital was so important because we can bounce ideas off of each other. And ultimately, delirium is a disease process that doesn't discriminate based on age.
And on our side, in ambulatory care, this will be the first time that we're going to be a part of their expansion plan. We know that our involvement wouldn't be far behind, so we're excited to be a part of it this year.
And year 3 was also the year that your team launched the first podcast episode featuring a patient who shared their experience with delirium. It was during the COVID-19 pandemic, and how the different parts of delirium stayed with him for some time after. Amy, what did you learn from that experience, and what can you share with the listeners?
Yeah, Jeremy, I think hearing directly from a patient who had suffered from delirium really grounded kind of the work that we do. He had been in the intensive care unit at Michigan Medicine during the pandemic, was isolated as he needed to be, but as part of his delirium from COVID, he was having hallucinations. He was extremely anxious. He was panicking. After he recovered from COVID and the delirium, he had a lot of psychological sequelae after that. So patients can develop post-traumatic stress disorder as a result of their delirium. And he had features of that and was seeking care for the post-traumatic stress disorder in a post-ICU clinic at Michigan Medicine. And he and his wife were very grateful for the care he received. But I think his story really reminded us of why this work matters. And it's not just from a clinical perspective or saving money or, saving time or things like that, but it's from emotional and humanistic perspective. Just the consequences that delirium can have on people physically and psychologically. It really reminds us of why we need to do work to educate people about delirium and do what we can to prevent it.
Year 4 brought new partnerships, new momentum, and even a new furry teammate who helped deepen engagement across units. Nicole, could you kind of share about our furry friend there and what he did?
Yeah, that year the ER and the ICUs were officially added to the rounding, and Bugle, one of the paws for patient dogs, quickly became a favorite because, it's very rare that people don't like dogs, but even just having a little furry friend to come and reorient people and make them realize that they're still in the hospital, but there's still life outside.
Bugle opened doors literally and figuratively, and not just for patients, but it helped with nurse engagement in the delirium rounding. And those moments of calm helped spark meaningful conversations with the nurses. It brought the nurses to us because who doesn't like a dog? Who doesn't like a pet?
Yeah, that's true, Lakeisha. Yeah, we also brought back the podcast, so we had that kind of re-released the rap podcast that we had done the year prior. Again, just trying to drive home the stories about real people suffering from delirium to help people understand the importance of why this matters.
And after those rounds, I get multiple calls monthly with the nurses asking, like, what kind of can you help me with the project? I'm thinking about these patients are having delirium on my unit, and I want to do some kind of project or initiative. I just recently got a email from a nurse in the neuro ICU, and she wanted to work on mobility improving mobility at certain times of the day and night, just like what we would normally do in routine to help decrease that delirium, nighttime delirium, or just overall delirium in the ICU. So I gave her some suggestions on what to do, and then me and her CNS will work together with her to kind of figure out what project that they would do in the ICU, in the neuro ICU.
Yeah, I mean, I think those rounding efforts that we've been doing lead people to then reach out to us on the committee or in the hallway and say, hey, I didn't know X, Y, or Z about delirium, but this is how it applies to my population. I think we also really, as the delirium committee, tried to focus on how do we better pick up cases of delirium in the hospital and realize that our screening tools were maybe not doing the best job. So Lakeisha really helped spearhead an effort to kind of train the nurses on a new delirium screening tool called the 4AT. And then we can use World Delirium Awareness Day to then reinforce education about the 4AT and show them success stories about how we picked up more cases of delirium. So the rounding and then the education kind of feed off of each other in that perspective. And then last year, I'm proud of, I wrote some trivia questions that kind of try to address some common myths that I was seeing in my clinical work in the hospital as a psychiatric consultant. I was seeing, myths about delirium. And so I wrote some trivia questions to try to dispel the myths. And then we would pass those out. People would answer the trivia questions. And if they participated, could get entered in the drawing. And then we would have conversations about the answers to the questions. And we would help provide information about why a certain answer was correct or incorrect. And it led to, again, a lot of really good engagement. And then we would have resources to give the staff if they wanted more information. So we handed that out as well.
And then meanwhile at Mott, we reinforced some of these key points that we have learned throughout the years. And our consistency has helped strengthen our culture where delirium awareness has become part of our everyday practice in Mott.
It's very interesting because on this side now, I'm a nurse that is in the outpatient setting, but prior to, I was a nurse in the inpatient setting where I did have to see all of the works that they're doing or continue these delirium screenings for patients. So the expansion with the ICU and the PET therapy has showed us how adaptable and creative that delirium education can be. And pretty much we're trying to implement that on this side to continue our delirium education for the outpatient setting.
That's a terrific background, the history throughout the years and how it kind of sets the stage for what we're doing right now, which is we're talking about year 5. It's your milestone year filled with, lots of major expansion and new partnerships and, visibility nationwide. Before we get into too much about, what's new this year, let's highlight a special guest who will be speaking at the March 10th Nurse Leadership Forum. Lakeisha, do you want to provide some more information about that?
So we're honored to welcome Dr. Heidi Linthrop. She's a national delirium leader. She's a nurse neuroscience at Mayo Clinic, and she's going to be speaking at our Nurse Leadership Forum. And for those who cannot make it, we will have a recording for Dr. Linthrop.
So this year recognizes a critical truth that delirium doesn't stop at discharge. Lakeisha, could you kind of share what this means for our patients at Michigan Medicine?
So exactly. Many patients leave the hospital still recovering from delirium, and too often they fall through the cracks. That's why ambulatory care became a major focus with the Delirium Prevention Committee, and we really worked hard to try to get them involved this year. And so it was very helpful that Kiara joined us this year. She was elected as one of our Delirium Committee members, and so that made it a little bit easier to work on that ambulatory side.
Yeah, I think I agree. It's been great to have Kiara's perspective in working with the cancer setting patients. I think ambulatory care teams play a really vital role. And there's especially, several key ambulatory clinics where it's really important to know about delirium. These clinics may see people before they develop delirium or after they get out of the hospital and are still suffering from delirium. I mean, there's the cancer clinics, which I'll let Kiara speak to, and that's a very common population that can develop delirium. But we also think about preoperative clinics in surgery departments. So pre-op patients, that come in for their preoperative evaluation, these patients are at risk for developing delirium after surgery. And I mean, in some surgical settings, people can be as high as 50% to 80% of the patients may develop delirium after a major surgery, such as some of the intensive cardiac surgeries. But a lot of these patients aren't aware of this. They think about all the other complications they can have postoperatively, but delirium isn't one of the things they're thinking about. So, my hope is we can continue expanding into, pre-op clinics and making sure that the patients, families, staff, providers are aware of delirium and talking to the patients about this. And then also in geriatric clinics. I mean, geriatricians are very familiar with delirium. And in the hospital, the psychiatric and geriatric consult teams are the two main teams that help manage delirium in the hospital. But older adults are vulnerable to delirium based on, their age, their older age. A lot of them have more medical comorbidities, which is a huge risk factor for delirium. Some of them have neurodegenerative disorders like dementia, and that's also a major risk factor for someone to develop delirium. So these ambulatory geriatric clinics are also wonderful partners in our efforts to educate about delirium. So bringing, the delirium awareness into these ambulatory care clinics really ensures continuity of care from, pre-hospital, hospital to post-hospital, and allows for safer care transitions when people go home.
So just to piggyback off of what Amy has said, on this side in ambulatory care, we are looking at it from a lens of our clinic side, where you have the nurses that are assessing patients that are coming in and out of visits, and then you have the infusion side. In the clinic, we do have to taking into account the age of these patients. For instance, my prostate clinic, those are the ones that I'm most worried about. They have a lot of comorbidities that put them at risk for this. We are working with our unit-based committee to make sure that nurses are prepared and understand how to assess patients if they are experiencing these new acute changes. On the infusion side, we are looking for changes that may predispose the person to having like grogginess, such as our pre-medications. It's a new initiative that our PharmDs have worked on. We have recently implemented changing our pre-meds from Benadryl to Zyrtec so that we can reduce the time that the patient may experience some cognitive changes or some grogginess. A lot of the time, our patients are driving themselves to these visits, these infusion visits, and it puts the risk that much higher with them going home by themselves as well.
And so extending our rounding into ambulatory care at the cancer center and into general care and ICU units at the pavilion. So we have the new pavilion. And a lot of our patients that were in the UH hospital, they moved over to the pavilion. So we will make sure to round in the pavilion as well, so we can see those patients and those nurses. And we have an expansion and we've expanded the number of therapy dogs that will be joining us this year. So we have 4 additional dogs and they're with Therapause program, so they will be joining us this year.
And of course, we will have the therapy dog and handler rounding with us in the pediatric world. Pediatric delirium awareness continues to grow, and families are appreciating the focus with the rounds.
Yeah, cross-campus collaboration is really more important now than ever. And it is just so helpful to have everybody come together and, like I said before, bounce ideas off of each other.
So we want to continue integrating education and collaborative work across the system, across disciplines. And over here, we'll continue updating resources that are beneficial for both the patient and the family and our nurses as well.
And I did want to say one more thing about ambulatory clinic. We've been so fortunate to be able to go and round in the cancer clinics when we round next week. So the other thing, because our ambulatory clinics are so massive, that department is so massive, that area is so massive. I did reach out to all of their educators in those clinics, and I sent over general delirium information. And I also let them know that we have patient and family guides that we that U of M, University of Michigan, Michigan Medicine has for them to use to share with patients and families so that they're educated, the nurses are educated, and that those outpatients and our patients outpatient in the community, they're educated and they're aware as well. Let's discuss safety awareness, the safety awareness team and our partnership with them. Our partnership with the safety awareness team remains one of our strongest traditions. So we began working with them in year 2. This year, we also contributed to their Delirium template to their daily huddle toolkit. So the safety awareness team, they created a daily huddle toolkit for Monday through Friday. And then we're going to use the Delirium toolkit on Wednesday, which is the actual World Delirium Awareness Day. And that gives the leaders a ready-to-use script for World Delirium Awareness Day. And so it'll questions there. Nurses will be able to ask questions at the DMS Safety Huddle Board regarding delirium. And if they have a delirious patient, they can focus on those patients that's on the unit with delirium.
Lakeisha, your team was also invited to present the National American Delirium Society Conference. How does that feel?
This is a great honor. I am so excited. And then looking at the work from year 1 to 5, and then to be invited to this national conference, I'm overjoyed. So from toolkits, our title is from toolkits to it's total transformation to system-wide total transformation. The growth has been amazing. And I still see nurses to this day wearing the little World Delirium Awareness lapel pins, and also their T-shirts. And sometimes I'll wear my T-shirt as well. But when I see those reminders, I know it's been truly an impact, that impact's been made for the nurses. And I'm going to see if possible, if we can get London, one of our Pause for Patients therapy dogs, to join us. I actually put the S-bar in last night, talked with the handler. And so we're just keeping our fingers crossed that London can go with us. So that would be great.
That would be a lot of fun. Who doesn't like, petting a dog at the end of a long day and celebrating together? So congratulations to you all. Clearly 5 years ago, this began as an email and, a toolkit, just something on a screen. And today you've created a movement and created great awareness across our health system. So thank you again for all of you joining us. And that is all that we have for today's podcast. We thank our guests for joining us, and to everybody at Michigan Medicine who has helped strengthen delirium awareness prevention. Thank you for all you do for our patients and their families and each other, and we'll see you next time.